listeners, my name is Trish Murphy. I'm with the Orlando Medical News, and today we're with the Florida Hospital Medical Group and Radiology Specialist of Florida. And we're talking about women's health and breast cancer awareness. Today I'm with Dr. Amy Campbell, who's a radiologist, and Dr. McCrae, who is a breast surgeon. So we're going to start with you, Dr. Campbell. As we all know, mammograms are incredibly important, but at what point do you get involved in the diagnosis and prevention of breast cancer?
So a lot of patients present to us for their annual screening mammogram. At the time of the screening mammogram, we evaluate for findings that we think might be suspicious for breast cancer. Those patients will get recalled from their screening mammogram for additional diagnostic mammogram and maybe an ultrasound. Those cases would be to look at calcifications or maybe a new mass in the breast. Additional patients that we see along the line will be ones that present with new symptoms, maybe a palpable lump or nipple discharge that we also do diagnostic imaging for. A small percentage of the patients we see at diagnostic imaging will eventually get recommended for a biopsy. Those patients will often come back to us for a biopsy. There are times they may go see a surgeon for a biopsy. And those biopsies, if they come back with a cancer diagnosis, will then lead to a referral to one of our local breast surgeons.
So Dr. McCrae, when a patient is diagnosed with breast cancer, what are the next steps?
With early breast cancer, patients are offered options for their treatment for their breast cancer. And these options include breast conservation, which includes lumpectomy and radiation, or mastectomy.
So Dr. Campbell, if seed localization is an option for a patient, that's when you step in. So can you tell us more about that procedure and the benefits of it?
Sure. For many years, we would localize the cancers for the surgeons with an old procedure known as a wire localization, where the patient had to actually present on the morning of their surgery, and we would help guide the surgeons to the lesion by placing a wire that went through the skin and down through the breast to the mass or calcifications or residual cancer that was left in the breast. And the surgeons would use that wire to basically guide themselves down to the lesion so they could remove it. The downside of that particular procedure is that it has to be performed the day of surgery. And most surgery patients, as Dr. McCrae would tell you, have a very, very busy morning. They oftentimes have to come in early to see anesthesia. They might have to undergo a separate procedure called lymphoscintigraphy. Then they have to come see us. So it's a long morning before they even get to the operating room for their surgery. So one of the big benefits of the radioactive seed procedure is that it allows us to decouple that process, because that seed can be placed anywhere up to 5 days prior to surgery. In addition, rather than the patient leaving our suite with a wire extending from the outside of the breast that's about the thickness of fishing wire, then the patient doesn't have to leave with anything sticking out of their breast, which for many obvious reasons improves patient satisfaction. The seed placements have been ongoing in several big centers for probably a decade now, and we've adopted it here at Florida Hospital. In addition to the convenience, they're very easy to place. We place them in the same manner in which we placed the wires. We can place them either under mammography or under ultrasound guidance. They go in through a very small needle, about the size that you would have placed if you were having an IV started. So it's a small needle. The seed is placed into the needle, and then we get the needle in position and we simply deploy the seed. The seeds are about the size of a grain of rice, and they're a seed called iodine 125. I know a lot of people think radioactive seed and think that it's something to be extremely wary of, but they're actually extremely low dose. With very little exposure to the patient or their surrounding, maybe family, friends, pets, or other people they may come in contact with, which is what allows us to leave them into the breast for up to 5 days prior to surgery.
Excellent. So that sounds like that turns into a potentially very scary situation, makes it less intimidating for the patient.
Absolutely.
So Dr. McCrae, what advantages from a surgeon's perspective does the seed localization have?
The benefits for a surgeon would be that we are not stuck making a certain incision. Of course, our main priority is oncologic and making sure that the cancer is removed. However, our second priority is cosmesis. And with the seed, I am able to place an incision more cosmetically appealing, such as a periareolar incision or an inframammary incision. With the previous wire localization, there are times where we actually get stuck placing an incision where it is more visible to a patient when in a sort of low-cut dress or a piece of bathing suit or a bathing suit. Therefore, with this seed localization, we are able to make our incisions more cosmetically appealing for them.
Great. So it really sounds like from both, from the beginning to the end, it's just much better for the patient.
Yes.
Great. So Dr. Campbell, can you tell us more about Radiology Specialists of Florida?
Sure. We are a multi-specialty radiology group. People think of radiologists as all a group that just sit in a room and read things in the dark, right? And that we might read everything across the board, but in our group we actually have radiologists who are individually trained with either additional training or fellowship in particular areas, from neuroradiology to body imaging to pediatrics, and we have a very large group in this case that does women's imaging that's just dedicated to those particular subspecialties. So we provide a really detailed level of interpretation.
Listeners, thank you for joining us again, and remember to choose Radiology Specialist of Florida at Florida Hospital for all your imaging and diagnostic needs.